The following webinar is brought to you by the National Center for School Mental Health at the University of Maryland School of Medicine in collaboration with the University of Maryland School Mental Health Program.
Hello, and welcome to our Telemental Health 101 training. My name is Jennifer Cox, and I work for the National Center for School Mental Health. I'm also the Program Director of the University of Maryland School Mental Health Program. Welcome to our training. I hope that you find this presentation very helpful and that you're able to use the information and the tips that we provide today to build your confidence and your competence in using telemental health. I wanted to start today just to review what is telemental health. Telemental health may also be referred to as telebehavioral health or telepsychiatry, but it all involves the use of video teleconferencing to deliver mental health care or education from a distance. Additionally, this teleconferencing is live, and it may look different ways. You may use telemental health for a counselor to be on one end and the client to be on the other, or you may have a psychiatrist on one end and a client on the other. All of these are considered telemental health. Here's just one example of how we use telemental health. In this picture, you can see that the mental health provider is on one end and they happen to be in their office, and the student or family is on the other end. This is changing currently as we cope with COVID-19, as we are telling into families' homes. And we're going to be talking about the important considerations we need to think about when we are using telemental health to enter a patient's home. So why are we using telemental health? Well, for right now, it's really important as many of the providers are at home and need to still provide services to patients in their home. Additionally, it improves access. It is timely. It has spared burden and cost of transportation. So in a normal situation when we are able to travel to homes or to clinics, we are wasting time. We are driving around, and during that drive time, we could be seeing clients. But with tele, we can remain in one space and go into homes without having to drive or pay for that mileage or the gas. Additionally, with a shortage of psychiatrists, it is a great platform to use because it allows for psychiatrists, again, to have more time and to be able to see more clients. It's convenient, it's cost efficient, and most importantly, our students and our families like it. We have been using telemental health for several years, and we will talk a little bit more later, but the evidence all shows that our families and our clients enjoy using telemental health and that it is just as good as in-person services. Additionally, if you ever need to bring together a multidisciplinary team, many team members can be in different settings and still be able to attend a meeting if you're using telemental health. Of course, there are exceptions, as with any practice, and safety concerns and student refusal will impact the ability to do telemental health. So as I mentioned, there is a lot of evidence out there that telemental health is feasible. It's feasible, it's acceptable, and it's been delivered across developmental status and to youth with various disorders. Our early work with telemental health suggests that the outcomes are comparable to in-person services. So there really doesn't seem to be a reason not to use it. Additionally, the evidence tells us that there has been high satisfaction among patients and caregivers. As providers, we know that building rapport is extremely important, and we know this comes up as a concern for providers that they think maybe we're not able to build that rapport or that therapeutic alliance. However, again, the evidence suggests that it is just, you are able to do it. We have to be a little more creative. We have to think out of the box a little bit, but we can still build rapport and build that therapeutic alliance. Things can be done over tele, such as drawing artwork, sharing artwork, doing dances, doing office tours, playing hide and go seek. And there's a lot of online resources that we will talk about later that you can also bring into your teletherapy sessions. And again, there are safety concerns. We want to make sure that we are being proactive about those things. In our traditional outpatient model, where our clients are coming to see us, we know that we have our standard operating procedures. So when you are doing home-based or telemental health therapy, you need to make sure that you are taking those things into consideration, especially if you have patients that may be high risk. Here at the University of Maryland, in our school mental health program, we have been using telehealth since 2014. And again, I can tell you that our clients and our caregivers have been very happy with our services and find it very comparable to face-to-face visits. Where we did find some dissatisfaction was mostly in providers, and not in the session necessarily, but they felt like how they were trained and that they hadn't maybe received enough training was impacting their work. However, our clients and our caregivers didn't feel that. So what we did is we provided more training. We helped providers feel comfortable. And once they were, that satisfaction rate went up. So again, we hope that this training will help you to build that confidence and that competence so that you can feel comfortable when you are providing telemental health. We wanted to give a few practical pointers, and again, to help you to feel confident and more competent. Our first pointer is to consider the physical location for both the provider and the client. As noted here, we want to consider privacy, adequate lighting, and minimizing environmental distractions. And again, this is for both sides, where the provider is and where the client is. For privacy, consider what your client will see when you are in a telemental health session. Consider the background. Do you have personal pictures behind you that your client will see? And is that something that you are comfortable sharing? You want to protect your own privacy. On the end of the client, you want to be sure to remind them that you are able to see into their home. If there's things that they don't want you to see, you want to make sure that you are prompting them to make sure they're considering their background and putting away those items. For lighting, it is important that our clients can see everything that is in the room behind us. If it is dark and they are not able to see, it can create some source of anxiety. And during the session, they may be checking out your background rather than paying attention to you and paying attention to the session. In addition to your lighting, you want to make sure that your client has good lighting for them on their end. This is for your benefit, to be able to see what is behind them, to see who is in the room, to see if any additional people have entered the room. Finally, you want to consider minimizing environmental distractions. On both ends, there may be a certain level of noise that you want to try to anticipate as much as possible. Do you or your client have a pet that may be barking at the door or jumping into your lap? We want to acknowledge those things ahead of time and consider how we're going to deal with them. As in any session, you want to establish a therapeutic space, and here are a few tips. Determine who is in the room on both sides of your telemental health appointment. Are there people in the home outside of the room that might be able to hear what's going on in the session? Does your client expect that people will be walking through the space where you're holding teletherapy? On your side, additionally, if you are practicing telemental health and you have a partner or children and they may be causing some noise, you might want to make sure that you're telling your client ahead of time to expect to hear those things. That way they can be prepared, and if it happens, you can manage it better in your session. Whenever there are additional people in the room, it's very important to make sure that they are on camera if at all possible, and make sure all those people are comfortable. Sometimes caregivers or siblings may be in the room, and it's important for you to be able to see them and to be able to read body language if they're participating in the session. Additionally, on your end, if you are doing telemental health from an office and there is a supervisor, maybe a psychiatrist or a trainee in the room, please let the client know that those folks are in the room and make sure they're on camera to make the client feel comfortable. When you're considering your space, consider that you might decide to give a tour. So I am currently working in an at-home office, and I have it set up as an office. And I would feel comfortable giving a client a virtual tour of what's in this room. Not everybody has that, but if you have a space that you're going to use, make sure you're comfortable doing that. If the client asks, what else is in the room? Who else is in the room? If you're not comfortable, don't offer that as an option. In establishing a therapeutic space, try to arrange for appropriate toys or resources. So you may consider what you need on the client's end as well as on your end. Some families may have different materials that you wish for them to gather up before a session, such as paper or pen or markers, or even some small toys that you might put to use. And you want to make sure that all of those things are available. So during the session, folks aren't having to try to run and get them. Also on your end, if you need something, you want to make sure it's within arm's reach. If I'm planning to use, even paper and pen, I want to have that handy so that I'm not having to get up, leave the session, and come back. That way we can keep our patients engaged in our session and keep us on video, keep them on video. Eye contact is always something to be considerate of too. During the session, you are going to have to monitor your eye contact and alternate the gaze between the screen and your video. Some tips for that: you can often, on many of these platforms, move your video or the video view of your client around. You could put that underneath the camera on your computer so that alternating your gaze is a little less distance in between. Also, you may want to consider keeping your image on the screen to monitor your own body language. Every once in a while, you may grab something and then hit the screen and not realize it. If you do that and then there's a strange view of you, then your client's going to see that for the rest of the session. But by having your own image on the screen, you can monitor it and make sure that what your client is seeing is appropriate and creating the best space for that teletherapy appointment. In setting up your therapeutic space, remember that staging matters and make sure that you prepare. Again, consider your background objects and colors. Make sure that you're framing participants. You will notice that I'm keeping my eyes about 2/3 the way up through the screen. Again, try to watch your eye contact. Try to look at the camera on your computer or your phone rather than monitoring other images on the screen. Consider your lighting and sound and eliminate distractions. Also, whenever possible, try to plug into the internet. Plug into your network if it is possible. If it's not, Wi-Fi is acceptable, but it takes a lot of bandwidth to transmit your picture. And so if you are plugged in, you're getting a better connection, and therefore you may get better transmission of your sound and of your visuals. Consider how some of these views that you see here may be perceived by your client, and remember our tips by not sitting too far back, not sitting too close, and not looking down, doing something else. If you look at the picture on the screen all the way to the left, you will see that she is framed in there. It is an inviting picture. Her lighting has been considered. It's a sunny day in that office, you can see, but she has pulled down her blinds to make sure that it's not blinding her client. And it's a comfortable way to sit, have a telesession, and it's comfortable for the client to see your image. You will find that using telemental health requires a lot more energy. We give the tip to be 110% of yourself. You have to be a little more animated. You have to try a little bit harder to engage clients when you're using telemental health. You can do things such as giving virtual high fives. Again, you can do some kind of dances. You can ask them to show you certain things that they've been learning. Let's say if they're participating in a dance class or a gymnastics class, or even if they're just learning baseball, show them this stance, or have your client show you the stance. These are all things to build rapport and engage clients and keep them in front of the screen where you can have your session. Do your best to avoid technique face. Be very aware of your facial expressions, especially consider if you might be squinting or moving closer to your camera or to your computer. No one really wants to have this guy looking back at them. Frequently, we may move forward to try to see something closer and squinting, and this is what it looks like. Again, nobody wants to have that staring back at them. Try to make this comfortable for your clients and so that your face is welcoming and that you're engaging them at all times. If you're looking for additional tips, we say take some tips from the pros. We recommend watching your local newscasters with the mute on. When you do that, you may notice that they are more animated. Their facial expressions are more exaggerated. Try to take some tips from them if you're trying to learn to do this better. For many agencies or programs, your program agency will tell you which platform to use. You will most likely have an approved platform. But here are a few considerations if it's not already been determined what platform you're going to use. First of all is cost. Right now, many of the platforms are free. However, that free period will run out. And you don't really want to get used to using this particular platform and then have to change if down the road you will not use it once it is not free. Consider all the technology offered. Some platforms are better for phones or computers, and you want to consider what your clients will be using and what will work best for them. Again, make it user-friendly. Some apps are more difficult to get on your phone and you have to go through more steps. So try to experience what the client is going to experience when you're practicing it. Practice maybe sending a session from your computer to your phone so that you can see how it works on both ends. Some tele-platforms are app-based while others are web-based. So consider again what's easiest for your client and what is going to be best for you. HIPAA compliance is also an important consideration. Right now, the federal and state regulations are relaxed. However, they will revert back, and you want to make sure that whatever platform you are using, that it is HIPAA compliant, so that we can protect our clients' privacy and confidentiality. Additionally, you will hear of a business associates agreement. I'm going to talk a little bit more about this later on in this presentation, but you need to consider how easy one of those is to set up with each platform. Additionally, you may want to look to your local boards and see what the compliance with specific regulations from your professional boards, your agencies, and other organizations, what kind of regulations exist, and make sure that you're in compliance with all of those. So when you're preparing for teletherapy, you want to consider a few things. First of all, again, you want to use an approved platform. Just because federal and state regulations are relaxed at this point, you want to check back with your programs, your agencies, to make sure that you are using whatever is approved. Make sure that you have all plugs and chargers available, and even that your computers or your phones are plugged in. Transmitting you visually over the internet takes up a lot of power, and so you never want your computer or your phone to die in the middle of a session. Make sure that you have a clear plan for the session. What will you be doing? What will you need? And are all of those materials around you? Are there any resources or websites that you want to share ahead of time with your client or caregiver? It's much easier to send those by email ahead of time rather than having to do those in the middle of the session and then waiting for your client or the caregiver to pull those resources up. Again, consider your background. If you're at home, you want to watch for open closets, personal pictures, and you may even consider for some of these platforms, they can allow you to put in a virtual background behind you. This can sometimes be fun to do with clients. So check what your platform offers, but you may be able to be sitting in your office and have a background, for example, of a beach. When you're preparing your teletherapy session, consider what you were doing in person and try to make it consistent, your tele session consistent with whatever you were doing in person. This will give your client a sense of ease and reduce any of anxiety. Again, check in with your families about resources for the session. What do they have available? Pens, paper, crayon? And also, what do you need for this session? I always like to keep a little bit of water with me. Doing teletherapy requires a lot of work and you may get thirsty, and it's nice to have that next to you or anything else, again, that you may need. Consider your personal appearance. Just because we're on tele and we may be in our homes at this point, it's really important to make sure that you're still presenting professionally. Consider the color that you're wearing and try to wear solid colors. When you wear clothing that has a lot of patterns, to transmit that visually, it takes up a lot more bandwidth and can reduce the quality of your telehealth session. So try to wear solid colors that look good in the good with your background. For example, if you had a yellow background, you maybe don't want to wear a yellow shirt because you won't stand out. It may be harder for your client to pay attention to you. As we mentioned earlier, this takes 110% of your energy, so you really want to bring it. You set the tone for your teletherapy session. And so if you are excited about the session, your client will be excited about the session. You're going to have to bring that extra oomph, but also at the same time, even if you might have some nerves, make sure that you're speaking clearly and slowly. Additionally, it's nice to bring some humor into sessions, just as if you were in person. If you are really trying to drive home a point with your client, make sure that you are repeating some of those points that you want them to understand and to make sure that you are clear about. Again, occasionally you might have a small glitch in the technology, and if it's a really important part of your session, you may want to repeat it or ask for them to repeat that back to you. During sessions, try to model nonverbal cues and active listening as much as possible. As you model it, your client may pick up on it and also be able to sit better during your telesession. So again, for example, with eye contact, try as much as possible to look at your camera rather than down at the screen, at your hands, at your phone, or something like that. You want to look on the screen as if you are in person actively listening. We've mentioned a few ways to creatively engage students. So be creative. Let's think out of the box. There are ways that you can do it, as we mentioned, by doing dances or sharing artwork. And again, on many platforms, there are different abilities. So for example, I know of at least 2 platforms that you can draw on the screen, and you can allow the patient to draw on the screen, and you can play tic-tac-toe or other fun games, again, to make the session even more engaging and build that rapport. Try to ride the wave of distraction as much as possible. Your first sessions that you have with your clients when they are getting used to teletherapy, you should expect that there's going to be a little more energy. There's going to be a lot more curiosity and interest in what is going on, and there may be a lot more body movement. So as much as possible, try to push through those distractions. And if needed, go ahead and take a break. You both may need a break. If you just take a short time out to come back and regroup, that is okay during telesessions too. However, if you do have technical issues, if there is a glitch in the system, don't push through those, because we want to make sure that the client is understanding everything you say and you are understanding everything that they say. Throughout your session, try to use praise as much as possible. Give that feedback. Wow, little Johnny, you're doing a great job with this. You are sitting so still. You're the best client that I had all day on tele. Way to go. Make sure you're providing that feedback so they want to remain engaged. And additionally, at the end of the session, provide a summary of how they did using teletherapy, and you can ask for feedback too, and they may have some tips for you. Here are a few tips for you to consider before starting your telemental health sessions. First of all, turn off all smart devices. For example, have a dot in my office. It is completely unplugged because I don't want to risk any confidentiality issues. All the smart devices, our Alexas, our dots, they are developed to be voice activated. And we want to make sure that we do not accidentally activate them during the session. And also they're listening. And so we don't want our smart devices listening to us during our therapy sessions. Close all of your extra browsers on your computer. If you have a lot of applications or browsers open in the background, they are using the power of your computer or your phone, and they're also using your bandwidth. So in order to have the best telemental health experience possible with the best visual and audio, we want to make sure we're closing everything down except for the platform that we are using. If possible, as a provider, if you have either wired or wireless headphones, we recommend that you use them. Many of the wired or wireless headphones have noise cancellation. So if there are some noises in the background, your headphones will not pick them up as much as if you're just working off of your computer or your phone. As always, people worry about technical issues, and technical issues do come up. So it's important to always have a backup. If your telemental health therapy session is too glitchy, you're having too many issues with audio or visual, you want to make sure that you have a backup in place. The best backup to have ready is a phone. You can transition from your teletherapy session, check in with the phone. If you need to end at that point, you can complete your session on the phone, end it sooner than later, whatever you need to do. But the main point is that you have something available to you so that your sessions are not abruptly cut off and your client is left hanging. As we mentioned before, plug directly into the internet if possible to have the best audio and visual. Additionally, set up space and routines that are familiar to students that have had in-person sessions. Some of our clients may have had in-person at this point and you're transitioning to telemental health. Others may be new. So consider your client and decide what is best when you're considering the routine and the structure of your sessions. If you're doing telemental health from home, consider using the same space each time if possible. So as I mentioned earlier, I'm in a home office and I would use this space for all of my clients each time that I meet with them. They will become familiar with this space, they will be familiar with the background and my placement in this room. If I were to switch it up, let's say to my kitchen, then our clients would then have to acclimate to a whole new space. That may bring additional anxiety and movement in our sessions, and we really want them to be able to focus on the session rather than our background and seeing what's in our home. As mentioned before, have websites and resources or tools available if needed. Here are some tips for during the session. So again, allow some time for a tour of your office or a tour of the home. Help the student and the family to establish some privacy. Our families and students probably don't realize the extent that we go to protect their privacy and their confidentiality. And when they are at home, they may not be thinking about those things. So for example, if other people are in the home that may hear the session, we want to talk about how to manage that and how to keep their session safe. A great idea is to create a do not disturb sign during one of your first sessions and put it on the door so that other people in the home know that that child is participating in something that is private and confidential. During sessions, try to use names as much as possible, especially when there are multiple people in the session. It's not always obvious who you're talking to, and it's a little more difficult to discern eye contact when you're doing telemental health. So you want to make sure if you're talking to mom, you start out by saying mom. And if you're talking to your talking to your client, then you are sure to use your client's name. Explain to your clients where to look and explain to them about eye contact so they have some idea what you're seeing and what to expect. Additionally, always use time checks. A lot of times the platforms that we choose will kick us out after a certain time period. So if your session is scheduled, for example, from 3 to 3:30, your platform may shut down at 3:30, depending again on the platform. We want to make sure that we are leaving enough time at the end of our sessions to end it appropriately and transition the child back into the home rather than just being cut off by the platform that we're using. We want to invite the caregiver to help with that transition back. When we are in our offices or our schools and we are transitioning a child out of our therapy session, we can hand them over to another person. When we're doing telehealth, we don't necessarily know who is around if we're not inviting them into the session to say, okay, our session has ended, it went well, and here's our homework between now and our next session, here's when we're gonna meet again, and it's just nice to be able to have that warm handoff. When you're in the session, if you think that something's going on with your technology, check in with your client or your caregiver, whoever you're talking to say, hey, am I coming through okay? Can you hear me okay? Do you see me okay? It's good to check in a couple times during the session just to make sure, because our clients and caregivers may not feel comfortable speaking up, and we want to make sure that we are the ones bringing it up and checking in with them. You can use screen share or other PowerPoints during your session. So check out the technology on your platform, see what you're capable of, see what the platform is capable of. Again, this can help in engaging and building rapport. Be really aware of the volume of your voice. Again, we do not know who is in the home when we're providing telemental health. And if we're speaking too loudly, it just increases the chances that somebody in the other room is going to hear part of our session. And as you're doing multiple sessions with your clients and caregivers, you may think about compiling a bin or a pile of things that they can use that as their homework bin, or to prepare it. Sometimes kids also want to show you a lot of things during the session, especially in the beginning sessions. So if they want, hey, look at my toy dinosaur, and look at my toy train. I mean, that could go on and on and on and on and on. So what you might want to do is say, create a bin, keep it on the side, and say, great, you can have 2 minutes to show me items now, and maybe 2 minutes at the end of the session, so that we know those things are in the space. They are there to be shared when the therapist when it is appropriate. Before sessions or at the beginning of sessions, you should also provide tips to your clients and to the caregivers. Some people may be familiar with doing telemental health or even telehealth appointments, and other client and caregivers, maybe this might be their first experience. So beforehand or at the beginning of your sessions, again, give some of these tips. Make sure that you have a plug or a charger available on their end. You can explain to them that doing this takes up a lot of battery, and again, we don't want our sessions to end abruptly. It is also helpful to create some sort of stand or something to keep a phone from moving. So if your caregivers or your clients are using a phone to do telemental health and they are walking around with it like this, then your view is it's gonna get a little dizzy. So it's nice to have your caregiver or a client in one space. One idea you could do is using a Kleenex box and setting the phone up so that it stays still. You could also build rapport by creating stands out of Play-Doh or boxes or other materials that the child might have around the home. It could be a fun activity to do in one of your first sessions. But we just, again, want to make sure that the phone is staying still so the child's not running around and they feel like they can sit down in one space and pay attention to the session. We want to advise also our clients and caregivers to turn off all of their smart devices too, and provide an explanation of why. We can also give our client and caregivers some feedback about eye contact. We've mentioned this a little bit earlier, but preparing them for this so that they understand is an important consideration. Some of our families may have wired or wireless headphones at home. Many of our clients are using headphones for gaming, and they can also plug into phones and computers. So if they have them at home, we can also encourage the use of headphones, again, to reduce the background noise. Additionally, you may want to consider giving clients and caregivers the direction that they need to let the therapist know if they didn't understand something that was going on in a telehealth appointment or telemental health appointment. If they just didn't understand because of the way it was explained, or if there was a teleglitch, video glitch, or audio glitch during the session, we want to make sure that our clients feel like they can speak up and say, hey, I didn't hear you, something happened. Please, can you repeat yourself? Also explain that you will have the backup system as a phone or whatever backup system you decide to have with your agency, but make sure that they know that if the teleappointment ends abruptly due to technology, that you will be contacting them by phone, and that your expectation is that you will be continuing the session, if nothing else, just to end it, but that just because it ends because of technology doesn't mean that the session should be ending. And as with us, we want to ask our clients and caregivers to plug in directly to the internet if possible, just to increase the visibility and audio that is shared. In preparing clients and caregivers, we need to review privacy and confidentiality now that we are entering their homes. As I mentioned before, we do a lot of work when clients are visiting our offices to make sure that it's private and confidential. And we want to make sure that we're putting some considerations into place when we are coming into their homes. So review the standards of confidentiality and the guidelines. It's never a bad thing to do. Consider who is in the home. Do the family members in the home or other people that may be in the home at the time know that that child is receiving services? When a client is brought to an office or gets services in a school, we don't necessarily know if other people in their home know about those services, and they are able to keep that confidential that they are even getting services at all. It may be more difficult when we are doing telemental health in the home. Some families use noise machines at night for sleeping. These may be ideal also for therapy sessions. You can ask about noise machines and direct them how to use them in the home so that people can't hear the session if they're in one room and the family's in another. And as always, just be respectful that you are entering a child's home. This is a new situation, a new mode of therapy for them in some cases, and we want to be respectful and prepare them for coming into the home and knowing what to expect. Client safety is always on our mind, and we want to be proactive as possible. At the beginning of your telemental health sessions, it's important to get emergency information or emergency contacts. Make sure that you have at least 2 emergency contacts whenever you're doing telemental health. My suggestion is that you have an emergency contact that is in the home and also one that is outside the home. Develop a safety plan or review an existing safety plan if you have already been working with a client and you know that they may be higher risk. As needed, create new plans and identify local hotlines, emergency numbers, or resources that clients and families can use if something should come up and they are in the home and you are off-site. And as always, if you are concerned about a student's safety and you believe that they are not going to be safe, you can refer them to the ER or you can call the police for a safety check. In being proactive, you may consider building a toolbox of coping strategies and supports for students and caregivers, something for them to have at home that is easily accessible. This toolbox may include, again, the emergency resources or hotlines. It may be reminders of skills that you're using in therapy to calm or to reground themselves. Here are a few tips for starting or introducing telehealth to clients. First of all, explain what teletherapy is and how it works. Also, you can describe the benefits of teletherapy. For example, getting more access to clients, being able to see them more frequently. You can also explain to students that people have done this before, that lots of other kids have participated in telemental health and that they are happy in doing it. When you're explaining telemental health, make sure that you're confident. If you explain this in a way where you're presenting it with no anxiety and that you feel confident about doing it, your client and your caregivers will be confident about it also. However, if caregivers or clients decide that they do not want to participate in teletherapy, then you have to let them know that there are other options and that they have the right to say that they do not want to do that. Informed consent. So be sure that you're addressing informed consent. It's important to discuss confidentiality and the limits and how it is maintained. Discuss potential risks, benefits, and the limitations of teletherapy. Again, cover the student and caregiver's right to refuse or withdraw from telemental health at any time. It's extremely important, again, to determine 1 to 2 emergency contacts and create a plan in case of emergencies. And also let the families and your clients know what will happen if you feel like there is a grave safety concern. You should also discuss alternatives if there are technology issues, such as moving to the phone, and make sure that you are documenting and obtaining consent and assent. So, getting started in a teletherapy session. When getting started, remind students and families that their sessions are not being recorded. This is often a concern with many of our families and our clients, and we want to put them at ease that if we were recording this, and most platforms, they would see some kind of notice or hear some kind of warning that it is being recorded. Very important to building that trust in telemental health. Again, find out who is in the room or who is nearby who may be able to hear the telemental health session. Orient students to the space and let them orient you to their space. And one important tip really is to determine a special signal. If you are working with a client and they are in a room and somebody walks into that room and it is off screen, you can't see it, you want to develop a way for that client to communicate to you without having to say, hey, mom's in the room, stop talking, that you should just stop the session. So for example, you might touch a nose, pull an ear, I don't know, make a face, whatever it is. Again, this could be a fun rapport building activity in the beginning, but you want to make sure that you have that signal so that you can build that sense of trust and confidentiality and privacy if a session needs to stop for some reason. Also, it's really nice to use an icebreaker or a rapport building activity in the beginning. So be creative, think outside the box. During the session, make sure that you are paying attention to nonverbal cues. If a client starts looking in the corners or seems off in some way, you want to check in to see what's going on. You cannot see everything in that room. You are limited to what is on the camera. And so it's really important to check in to see if you should continue the session or not. Again, make sure that you're looking for that special signal. You don't want them to make the signal and you miss it. We want to make sure they're feeling comfortable and confident that if a session needs to be stopped, it will be stopped. If there's technical issues during your session, make sure you stop and address them. You don't want to push through because, again, it's important what you are saying and it is important what the client is saying. Most technical issues with glitches in the video or in audio will pass within a couple seconds to a minute. And so we want to make sure that we let those pass and then continue our session so that we can have the best experience possible. In ending the session, make sure that you're leaving time for that transition. For younger children, you may be transitioning that child back to a parent, and we want to have somebody come in, and that may even be the case for our older teenage clients also. So make sure you're leaving that time. Again, and try to include the caregivers in the discussion for action plans, recommendations, or homework that you've given the child to complete in between your session and the next planned session. Ask for feedback. You want to know, what did they like about the telesession? What did they not like? Did they have any creative ideas? Some of our best ideas come from our clients. You can also ask them how your session can be improved. Ask for feedback on yourself. How did you do? Don't be afraid to ask for that feedback, accept it, and use it in the next session. It's important to always leave time also to plan for next time. When is your next session? What materials, what might the client need, and who will attend the next time? And always end on a positive activity or statement so that your client or caregiver remembers the session as being positive. Supervision is very important. Telemental health is changing by the day, and many providers are just getting into this. So we want to make sure that everyone is getting the supervision and the support that they need. Remember that we need to support trainees through training, supervision, and coaching. It's important to also seek peer-to-peer supervision from other clinicians or trainees around you. As we're all being creative and thinking out of the box, we want to share those ideas. Seek additional trainings. Again, telemental health is changing, and we want to make sure we're staying up to date. Try to increase your comfort through practice. You can turn on your video or camera on your computer, on your phone, and practice just being on the screen. See what you look like. See what the lighting looks like. Increase your comfort by practice. Make sure to check with your state and federal regulations to make sure that you are documenting everything correctly and that you are conducting telemental health within the correct regulations of all of the federal, state, and board regulations. All of these regulations are changing quickly, and we want to make sure that we stay up to date on them. Just a little bit of telemental health lingo. So you may hear people referring to the originating site or the distance site. Keep in mind that the originating site is the student's location and the distance site is the therapist's location. Other telemental health lingo that you may hear about is a business associate agreement. The HIPAA regulations call this a business associate contract. They're really the same thing. Business associate agreements satisfy HIPAA regulations and create a bond of liability that binds two parties. So, for example, you and your web platform. Currently, business associate agreements are being waived by the federal and state authorities, but this is something you will need once this time passes. Here are a few references if you would like to check them out for more information on telemental health. And I just want to end by thanking you so much for attending our training. We hope that our tips have been helpful, and we wish you all the best in your telemental health sessions. Stay well.
To learn more about using technology to support school mental health during the COVID-19 pandemic, visit our website at schoolmentalhealth.org and click on the COVID-19 Resources tab. You can also visit bit.ly/NCSMH-COVID-19.